Hi there, and welcome to our latest edition of 12 Health. I'm Shannon Heggie, and today I am joined by Dr. Ian Newberry, who's a head and neck surgeon with Brown Health and Rhode Island ENT. Thank you so much for being with us, Ian. Ian's here because he was the first surgeon in Rhode Island to bring the surgery here for the Inspire device. And this is specifically for people with sleep apnea and snoring disorders. And it's a pretty revolutionary thing for those patients because many of them use what are called CPAP machines, correct?
Yeah.
So we're going to get into what the Inspire device is and how it works. But first, Dr. Newberry, I just want to get into these sleep disorders. For people who don't know what this is, who are the people we're talking about and what is affecting their sleep and why?
So for this is with sleep apnea, obstructive sleep apnea, something stopping them breathing. It's the people that say, hey, my husband is snoring and he stops breathing. I think he's going to die in the middle of the night. It's for those patients. So you'll get a sleep study. The first line therapy, no matter what, is CPAP. It's just going to be a device that helps you breathe, helps there not be obstruction while you're sleeping. But the data shows that only about 50% of people that actually go on to CPAP actually tolerate that. So there's a long kind of list of people that cannot tolerate it. And when you're AHI, this apnea-hypopnea index is what it's called, this kind of measure of sleep apnea, is in the moderate to severe range. It actually not only just makes people tired, lethargic all the time, it can give them headaches, but more importantly, it can leave long-lasting problems. It can heart attack, stroke, pulmonary hypertension, atrial fibrillation, among other risks, with significant long kind of health risk over the course of their life. So it's not just a day-to-day quality of life thing. It's also something that can put you at significantly at risk of heart attack and stroke. So trying to give these patients something they can tolerate. So if they're not claustrophobic, if they're side sleepers, they're tossing and turning, not wanting something on their face, then there are other surgical devices, surgeries that can help with this.
Gotcha. We just had some video on the screen of what a CPAP machine looks like for those of you out there who are not familiar with it. And just looking at the video, I've never slept with one, but it looks extremely uncomfortable. And it works almost like an oxygen mask, right? Where it's constantly
It's just blowing air, kind of blowing everything up so that whatever is collapsing, if it's your tongue base, if it's your palate, if it's your tonsils, something is kind of collapsing while you're sleeping, it's just blowing it up like a balloon so it doesn't collapse. If you can kind of think about some of these patients are having such high volumes that it's almost like kind of almost putting your head out the window and driving down the highway with the high enough pressures that, I mean, most people cannot tolerate that when it's getting up that high.
Right. I mean, we've done a 12 Health about the importance of sleep and how much sleep you should be getting. I have to imagine that for these patients, not only is their quality of life impacted because they're probably not getting a good sleep, but then those CPAP machines, I mean, is there a percentage of people that can tolerate that those actually work for?
About 50%. So it's actually higher than you would think. I mean,
yeah,
there's some people that say, hey, I've done this and I'm just getting the most refreshed sleep I've had. And they're like, I can't sleep without it. There's some people that just love the way they feel because they're getting normal sleep.
Yeah.
They don't really care. Now, that's where kind of the things are changing right now. Previously used to be, oh, you can only get this if you do not tolerate CPAP. There are people going to where I don't want to do CPAP. I recently did one on a patient that just wanted to go backpacking. He was an avid backpacker going around the world backpacking, and he was not taking his CPAP with him.
That's a good point, because to travel with that's got to be a lot.
Yeah.
So just for some context, according to Johns Hopkins, there are an estimated 30 million people in the U.S. with sleep apnea. And as Dr. Newberry was explaining, the National Institutes of Health defines it as either partial or complete recurring episodes of airway obstruction. So we're talking about something pretty serious. And like you said, it can actually cause you to stop breathing. I know a lot of people with sleep apnea will wake up and kind of go like, you know, in the middle of the night. So we talked about, you know, why these CPAP machines are not great for everybody out there. The Inspire device is actually something that is put inside your body surgically?
Yeah. To where the first thing you kind of have to do is, like, when you have this obstructive sleep apnea, is we got to figure out why. Back in the day, it used to be, hey, we're going to cut out your tonsils, cut out the little thing that hangs down your uvula, and it's going to help your sleep apnea. Would only help maybe 20 to 30% of the time in some patients.
And that doesn't sound like a surgery that's easy
it's
to
not
recover
a fun
from either.
surgery.
Yeah.
To where right now the first thing we do is something called a drug-induced sleep endoscopy, a DISE. It is a medicated nap. All you do is you get an IV and you take a good nap. You're breathing on your own. You get a medication, it makes you sleepy, you take a nap, and we put a scope into your nose, goes back into the back, and we can look at what exactly is obstructing. Because there are some things that the Inspire does not help. The last thing we want to do is a surgery that's not going to help the patient. To where we can then decide which surgery is best. There are multiple different surgeries. About 80% of the time, the Inspire is the correct surgery.
Okay.
And so, but there are a few things that are not helped with that. And so we want to make sure that that's not the case. And if so, we can do a different surgery. But the Inspire is kind of this novel thing that's helping 80% of patients. And so that's why we were so grateful to kind of be able to bring this to Rhode Island.
So just so we can get it out there, because maybe people know exactly what's causing their apnea, what are the things that the Inspire device cannot help with?
That's a little bit more technical. There's something in the very back of the nose where your palate is, to where usually it's closing front to back. But there are some people that also, their side walls actually collapsing to kind of what we call circumferential collapse. And so with that, the Inspire actually does not help kind of that lateral kind of expanding outwards as much. It's mostly meant front to back.
Gotcha.
For those people, there are other surgeries we can do to help with that.
Okay. All right, we're going to take a quick break, and when we come back, we're going to talk about the actual surgery and how the Inspire device works. Stay tuned. Welcome back to 12 Health. I'm Shannon Heggie, and today we're talking about a relatively new surgery here in Rhode Island for patients with sleep apnea. I'm joined by Dr. Ian Newberry with Brown Health and Rhode Island ENT. He was the surgeon responsible for bringing this surgery here to Rhode Island. So before the break, we kind of got into the nitty-gritty of what sleep apnea is and what are the obstructions that are causing this for a lot of people. Explain to us how the Inspire device works.
To where the good thing is previously we were kind of talking about other surgeries. With the other surgeries, usually it would help one of the many layers. It's kind of like onion. There's multiple different areas that actually collapse while you're sleeping. You would think, and that's why it's a little bit harder to treat in adults. In kids, you just take out their tonsils, they're better. Adults, not so much. There's usually multiple different areas that are collapsing. To where right now, now that the FDA has indicated this, it is a device that actually goes into the neck as well as the chest. One, we make a tiny little incision in the neck, and we actually go down to the nerve that controls your tongue. The cool thing about the tongue is there's different branches of the nerve. There's one that sticks out your tongue, one that pulls it back. We were looking for the one that sticks out your tongue. There are also branches of that nerve that come off that also stimulate the airway, that are going to be tighten up the airway to make sure it's not kind of just lax while you're sleeping. It's also going to be when your tongue comes forward, there's other things that pull your palate forward. The uvula and everything that kind of dangles, that is going to be pulled forward. Among other things, that'll just be tightening up the airway. So we're putting this little cuff. It's like a little, for lack of better terms, like a cover that just goes around the nerve. It's a little clear thing that just goes around the nerve, not hurting the nerve or anything. It's just a little cuff that goes around it. We then will tunnel that underneath the neck down kind of into the chest, where there's actually a device in the chest. It's kind of similar to a pacemaker, a tiny little thing that lives right on top of your pec muscle that senses when you're breathing in and out. We put a little sensor down kind of near the ribs that'll be sensing when you're breathing in and out. And whenever you're breathing in, everything's going out. Whenever you're breathing out, that's when the collapse usually happens, and the little device will tell your tongue as well as everything else to kind of tighten up and go forward. So the good thing is it's completely underneath the skin. You're not seeing anything like it. You're not having to bring anything with you. All you do is have a kind of a tiny little remote, kind of like a big kind of key to your car that just sits beside your bed or wherever you're at.
And that controls how strongly these stimulations are?
So
is it the hypoglossal nerve? Is that what we're talking about?
Exactly, the
See,
hypoglossal.
I did my homework.
Yeah, to where it is the hypoglossal nerve. So there's different, just like there's different pressures for the CPAP, there's different amounts of stimulation. You can stimulate the nerve a little bit, you can stimulate it a lot of it. So we're trying to find that after we put this in about 4 to 6 weeks later, we got to, over the next kind of a month to 2 or longer period, you're trying to figure out what is a good range for that patient. You don't want to, it's kind of Goldilocks. You don't want too much because no one's going to tolerate that. You don't want too little because you want to get rid of your sleep apnea. Because the cool thing about this device is actually 80% of people will have no further sleep apnea. 88% of people will not snore anymore after this, which is pretty good. The satisfaction rate on this is almost 92 to 93%, which for most things in today's day and age is pretty good.
Yeah. Now, it seems to me, and correct me if I'm wrong, if I'm trying to put this in terms that other people might understand, if you go to, a physical therapist and they put those little electrodes that make your muscles kind of tense up, is that the idea?
Similar. It's almost like I tell people, like, if they're to wake up, they're like, oh, this is going to be painful. It's not really a painful stimulus. It's more like a muscle twitch. If you're to wake up in the middle of the night, one, you could just turn it off. 2, if you did feel it, it would be more of like a twitch that you
Gotcha.
would have.
Okay.
So it's not painful or anything like that.
Thank you. Okay. So I know that this was approved by the FDA in 2014. Why is it something that is just coming here? I know when I heard from you, you said I think about 100 people
Yeah,
had the surgery here in Rhode Island.
Yeah.
So kind of explain your process of when you first heard about it to when you got it here in Rhode Island.
Yeah, as I was a kind of a med student down at UPenn, we were actually part of the STAR trial, and I was there for a little bit. And then going out to the University of Utah, we'd been doing this for a while. Now, once I got here, we, had to get insurance approval. That had something we had not really been doing. And Dr. John Taro, as well as Zach Quay, had been also helping to try to get this kind of the ball rolling on insurance approval, because that's a big part of it.
Right.
It's a very expensive thing that we want the insurance to pay for, not the patient. So now make sure that the insurance was approving it. So that was a big process that took a little bit. And making sure that we had people in Rhode Island that could do it.
So how long has it been, or have you been doing the surgery now?
We've been doing it for about a year.
Okay.
The first one was we actually did at Fatima, and now we've able to do it at Fatima as well as Brown Health.
So really from its approval to now, it took about 10 years to get it here in Rhode Island.
Yeah.
So let's go back into insurance, because I know that's probably the first question a lot of patients are thinking. Yeah. Can I afford this? Is my insurance going to cover it? So do you have, I know it differs by insurance provider, and probably when you talk about whether you're a candidate for it, are there certain qualifications that you have to meet? Yeah,
so the first thing has to be that you have moderate to severe sleep apnea. If you just snore a little bit and you do not have sleep apnea, not going to be approved for that. To where we need to get a sleep study, and it needs to show that you have either moderate to severe sleep apnea, and that's back to that little kind of scale of how bad your sleep apnea is. The AHI, the apnea-hypopnea index, how many times do you stop breathing per hour? If that's over 15 to 100 times an hour can be treated with the Inspire. Now, the other thing is you have to make sure that you're within the BMI, the weight range. And so right now it is now FDA approved up to a BMI of 40, which is, it used to be 35, and every insurance is a little bit different. But for the most part, if your BMI is less than 35, your weight is reasonable, to where right now this is medically indicated for that.
Is that a safety thing, or is that this could be caused by your weight, and you need to address that first?
Weight can play a part into it, and there's been studies that show like up to a BMI of 35, this device works very well. 35 to 40, it works well, but not as well.
Okay. So
once above over 40, there's multiple different things that it shows that you could just have a whole lot of things that are collapsing your airway that maybe the Inspire would not help enough.
Okay.
But now we have weight loss medications that some people are going to sleep medicine. They're working with their sleep specialists. They're going on medications to get them into a range to tolerate this device as well as other things. Because if we can get their sleep better, probably going to live a more healthy lifestyle too.
Gotcha. What's the average age of someone who is experiencing sleep apnea? Because I feel like we see it in older adults. Is it something that happens later in life?
Yep. And I mean, again, one, weight plays a place into this, but also laxity. If you're just getting kind of over time a little bit less tone within your airway, just as you age. But also we have the 24-year-old female who is physically fit, running marathons, coming in, and she has sleep apnea. Her AHI is 20. And it's not that she is morbidly obese or anything like that. It's a tone issue.
Gotcha.
And that's where this device can help tone. It's going to be stimulating that nerve, stimulating those muscles to have tone, to not collapse while you're sleeping.
Okay. We're going to take one more break, and we're going to come back and talk about how the little device works. There's an app on your phone, as with everything these days, to help with this. So we're going to get into the nitty-gritty on that in just a bit. Welcome back to 12 Health. I'm joined Ian Newberry. He's a head and neck surgeon with Brown Health and Rhode Island ENT, and he was instrumental in bringing the Inspire device surgery to Rhode Island for people with sleep apnea. So we've been talking about how the device works, the people that it's going to help. Before the break, I was asking what age we typically see sleep apnea in. And I asked that because when you see something like this, that's newer, that's technological. I know in a lot of the videos from the website, there's an app and there's a device and this and that. And that can be kind of overwhelming if you're an older patient. But you were saying, this is pretty user-friendly.
It can be as hands-on or hands-off as you want. To where, you're going to need to be a little bit savvy with it. But that's also our job after the post-operative phase, is teaching you how to use it. We're not just going to say, hey, figure it out on your own. This is going to be very much working with our colleagues in sleep medicine to really get to a range that you're tolerating and doing this well, to where not everyone falls asleep exactly within 10 minutes, 30 minutes, 60 minutes. So kind of customizing that to turn on once you're asleep. Usually sleep apnea is happening a little bit deeper into sleep. It's not happening within the first 60 minutes or so. It's going to worsen throughout the night, and so they can kind of tolerate that. They have a little device that they touch your chest.
Yeah, we've
have
got a
this
show and tell
right
here.
And so this is like something that you would have sitting beside your bed or wherever you sleep. You just touch your chest. There's a little
As you're
device
getting
under it.
ready to go to bed.
Yep, it'll beep. You put it away, and then depending on what type of sleep you have, turning on 30, 60 minutes or so later. And then it can be programmed to turn on for 6 to 8 hours. It really depends on how long you sleep.
And you'll, I guess, depending on how it's working or if it's working, your doctor will work with you to increase the level of stimulation, essentially?
To where, yeah, there's different levels of how much you're stimulating the tongue and how much you're trying to get everything to come forward. And so we can do that to where our goal is to get you to a range that you're tolerating and to make sure you don't have sleep apnea anymore.
And you do have the piece, too, that goes...
Yeah, so this is the little device that would be the only thing you would possibly feel in your body. Kind of like a pacemaker. Some people will have that. And I don't know
feel it right under your...
You could feel it right underneath your skin. This would be something that goes right. Typically, we do on the right side, just in case you ever do need a pacemaker or something else. A lot of times, they'll place it on the left. And we place this right underneath the skin, small incision. And you could feel, like if you were just sitting there kind of feeling it, you could probably feel it. Most people do not notice it at all, and when you have your shirt off, you're not really seeing it.
How, from your perspective, you know, as someone who watches people dealing with sleep apnea, and your life can fall apart when you're not sleeping. It's really hard to live, you know, a fulfilling life when you can't get enough sleep. Now that you have this surgery here, it's been here for about a year, how rewarding is it for you to be able to offer something that you know works and is customizable versus kind of the old way of surgery where, or even CPAP machines, that's just kind of a one-size-fits-all?
To where I think it's been really fun. Whenever you have a patient that comes in and tells them that you changed their life or you did something for them, it's really fun. I think this, and I do cochlear implants too, the most rewarding thing. When someone tells you you changed their life, it is so rewarding. To where a lot of patients will come in and say, hey, you know what? I was falling asleep. I almost got in a wreck. I was at a stoplight and I fell asleep during a stoplight. Or I just can't do this. I couldn't just function at any family function. I'd fall asleep. I couldn't do that. I was always grouchy. To where right now, if you're doing that, not only are you giving them their quality of life back, but also, as we kind of talked about, those risk factors, you're hopefully giving them a longer life too.
Any negative side effects, things people should know before they kind of go down this path?
To where it is a surgery. It's something that's going into your body. Like if you're going to be worried about something living in your body, probably would not be the best thing for you. But this would be a device that takes me about an hour. You go home the same day. And the battery in it, there's a little battery within this guy that lasts about 11 to 13 years. After that, you just pop the battery out. You don't need a big surgery or anything ever again. You just pop the battery out, pop it back in to where this will last you for your life. The battery would need to be replaced though in 11
I was going to
to
say,
13
I have to imagine at some point you have to go in. So you don't have to replace the whole device.
You don't go down in the neck, nothing like that. You just go into the chest. You find that little pacemaker-like thing.
So you go into your doctor.
Yep. And then we would we haven't even gotten to that point yet, to where theoretically, though, we just make a tiny little incision, pop out the battery, put a new battery in.
Wow, that's pretty wild. And you said about 100 patients so far.
Yeah, and we have a big list to where right now, the good thing is we're able to do this, and we're able to do it at multiple hospitals now. Previously, it was only done at Fatima Hospital.
Okay.
Now we're doing it at Miriam, we're doing it at Rhode Island Hospital, to where now we're getting that wait list significantly down.
Okay, so what kind of wait list did you have versus what you have now?
Well, being one of the first people kind of here, we had a wait list of almost 9 to 12 months to get this surgery done. To where now we've gotten it down. I do just the other day on a Monday, I did 3 or 4 of these in a Monday.
Wow. Do you think it's a matter of just getting the word out too at this point and letting people know that this is an option? Or do people with sleep apnea knew this was an option and they were really just waiting for it to get here?
To where people have been going to either up to Harvard, down to Yale. They have been going to different places for a little bit longer than Rhode Island, to where I think the word's been out, but I think now that we have this capability in Rhode Island, also the Inspire companies probably, if you've seen the ads, they've probably been also hitting Rhode Island a little bit harder with the ads and getting that message out.
Well, it must kill you too when you hear that patients have to go out of state to get this kind of a surgery done.
And some people, their insurance won't even let them do that. To where that is the thing is some people will have that and they know there's an option and they couldn't do it.
So is that the next hurdle? Is it, are there still some insurance companies that aren't covering this the way you want?
Now, to where there is neighborhood health right now, the hard thing is you need to do that drug-induced sleep endoscopy, that DISE. You need to make sure that it is the right thing for them. They're still not covering that. So neighborhood health does not cover. Every other one does.
Okay, what would you say to the person out there who's watching this and maybe is a little skeptical about this device, but is kind of at their wits' end with dealing with sleep apnea and the negative impacts of no sleep?
To where the first thing is we have patients. We have patients that have gone through it. We have patient advocates that have gone through it with the Inspire company. They can talk to these patients. They can get onto the Inspire website. They can go through information. They can make sure they feel comfortable, because the last thing you want to do is do a surgery on someone that's not comfortable. This is inevitably something that is an option. You don't have to do, but we want to make sure that our patients feel comfortable. And there's a lot of information to give them that comfort.
Are you, I mean, I know it's been around for a while, but are you still kind of inspired? That wasn't even on purpose, but it must be pretty cool to see, and we've watched all of the different medical advancements, especially when it comes to devices, medical engineering, things like this. Are you still kind of in awe of this invention and what it can do for people?
It's fun, yeah. To where right now I think it's only getting better to where eventually they might not even need the respirator down. Like right now I have to dissect down near the lungs and put a little respirator, which doesn't take me very long, but that is maybe going away in the future to where the little device that's up here may sense everything to where it may even become a sooner kind of type, a little quicker of a surgery.
Anything else I missed that you wanted to get out there about the Inspire device? All right. Well, Dr. Ian Newberry, a head and neck surgeon with Brown Health and RIENT, thank you so much for being with us. And if you want to learn about the Inspire device, they have a whole website with lots of videos and patient testimonials, and we will link that in the article on WPRI.com. Thank you for being with us, Ian, and thank you for joining us for this edition of 12 Health.